One of the most basic needs of health is the ability to have a good, healthy meal and feed your body so that you can go about your day, so that you can go to work, so that your children can go to school and function at a proper level.
We're already in a healthcare crisis, okay? And now they want to take away our SNAP benefits and stuff, especially the elderly, because the elderly, they don't tend to go out to frequent the soup kitchens. They don't tend to go out to frequent the food pantries. You know, if they can't get it, they just will do without. And then what's going to happen? More visits to the doctor's office, more visits to the ER, and then what was that? It's like a vicious circle. Okay. I'm 52 years old. I can't do anything hungry. I can't sleep hungry. I can't read hungry. I can't study hungry. Nothing hungry, because you know why? Because the only thing I'm thinking about is this growl that's in my stomach. And if our children go to school hungry, what's that's going to mean? That's going to mean that they can't concentrate. It's less concentration for them in school, you know, and then their grades are going to fall off. And then guess what? Then they're not going to graduate. They're not going to be, and then what they're going to do? They're going to turn to the streets, you know. So it all boils down to a good meal at night, so they can, at a well rest, so they can get up and go to school and be the best they can be.
When I was younger, a teenager, I used to eat junk food. I used to eat a lot of McDonald's. But I don't go to those places anymore because I noticed when I would eat those foods, I noticed that my performance was very poor. And I'll be sluggish, I'll be tired. But after a while, you know, I just changed my diet, and I noticed I'm energetic, I'm not tired, and I have endurance to do what I have to do on a day-to-day basis. Well, it's a little harder now since the cut. I have to critique the list. I have to take certain items off the list and substitute them for a cheaper brand.
My biggest challenge being on SNAP benefits is actually having the food last till the end of the month and being able to eat healthy foods until the end of the month. I have high blood pressure, so I have to be aware of sodium intake and things like that, and have to eat much healthier foods and try to stay with more fresh fruits and vegetables, and that can be a challenge when the food stamps don't even last until the end of the month. And let's say the children have vacation time or the holiday vacations and they're home more often, so there's more meals that need to be prepared during the day, so it's harder to make the food last. You know.
I became very aware of how important the food problem was for people actually of all walks of life, and especially for people that are struggling either because they're living in poverty or they have other disabilities. They could be seniors and elders, but it became more and more of a universal issue that definitely needed attention, and then got a lot worse when there was no store here. I was also in the food bank realm for many years, and oversaw programs where it became very apparent that this is a big problem in Connecticut with every part of the state, and especially in our big urban centers like New Haven. SNAP is critical, along with the other food assistance programs that we try to provide, and they're still not really fully meeting the need that we have in our population.
So at CARE, we applied and were lucky enough to get funding from the Newman's Own Foundation to do a SNAP outreach program within New Haven. A lot of times people who either know about SNAP or even people who don't know about SNAP and need to be connected to the program, there's a lot of stigma on being on a state program or being on government assistance, and that can be a barrier to getting on SNAP. Another barrier is just the idea of going to the state office and applying. So for people who are in marginalized populations like seniors or people who might not have transportation and really are stretching their budget, they might not be able to go across town to the state building, or they might not even understand the paperwork, need that extra help, that extra assistance to apply for SNAP.